if you're in pain or you've got an injury, you might be thinking about having a scan. And before you do so, there's a couple of important things you need to know. Firstly, what is available to you and how they work. And secondly, when it is actually appropriate and when it isn't appropriate to have a scan. This video is part 1 in a 2-part series on imaging and scans. And this one is going to be going through all the different scans that are available, how they work and what they're used for. Stay tuned for part 2, which will be coming to you very soon, and that will be on when it is and isn't appropriate to have a scan. Hello, it's Luke here from Genuine Physio, where we bring you honest, evidence-based information and education to get you guys back on the road to recovery. If you like what you see, then please give us a thumbs up, and if you haven't already, subscribe to the channel so you don't miss any more of our videos. You can find us on all of the main social media platforms, Twitter, Instagram and Facebook. And if you have any ideas, future content or feedback, then pop a comment below, and you should also find some useful information in the description below if you'd like to find out any more on this topic. So with that out of the way, let's get going. So in today's video, I'm going to go through the top 5 most common scans that are used. I'm going to discuss what they are, exactly how they work, and what conditions they are used to look at. At this point, it is important to note that I am purely coming from a musculoskeletal point of view. So that means muscle, tendon, bone, ligament, and nerve type injuries, nothing else. And ultimately, it will be up to the clinician treating or assessing you to have a conversation with you about what scan is most appropriate for you, if a scan is appropriate at all. X-rays, we all know what they are. Now, X-ray beams travel through the body and are absorbed in different amounts depending on the density of the tissue. Now, typically bones show up as white, muscle and fat tends to be a grey-like colour, and air pockets tend to look black, like the lungs, for example. Now, they're normally used to identify problems with bones or joints, and conditions commonly include things like fractures, infections in the bone, arthritis, other inflammatory bone conditions, and osteoporosis. Ultrasound, also known as sonography, works by using high-frequency sound waves that detect live images of the body. Now, this can be useful because you can get the person to move if needed whilst doing the scan. Now, you may have seen ultrasound used during pregnancy to check baby's health. It's the machine where they pop their hair gel-like substance on the area of skin, and then they go over it with a probe to take those live images. But it's also used with musculoskeletal conditions as well. Typically, ultrasound is used to diagnose more superficial injuries, injuries that are closer to the skin. Things like muscle, ligament or tendon, tears, sprains or ruptures, tendinopathies, problems with the bursa, hernias, nerve entrapment conditions, ganglion cysts, and joint inflammation and swelling. The third condition is an MRI, which is slightly more invasive than the other two because you have to lie on a bed, and that bed then takes you into a donut-shaped tunnel, if you like. And it also doesn't use any radiation, unlike an X-ray. Instead, radio waves realign naturally occurring hydrogen atoms in the body. As these hydrogen atoms realign, they emit different amounts of energy depending on the different types of tissue. Now, they would normally be used to diagnose slightly deeper issues in the body. They're often used to diagnose issues in the spine, maybe a disc herniation or other degenerative joint conditions. They can also be used to diagnose meniscal or ligament tears in the knee, muscle or joint tears in the shoulder, as well as other inflammatory joint conditions. The fourth type of scan is called a CT scan or a CAT scan. Now, this is probably used slightly less than the first 3 we've spoken about, but it does use X-rays. The difference between this and a standard X-ray is a standard X-ray will just take a fixed 2D image of the tissues in the body, whereas with the CT scan, we're back to our donut-shaped machine, and as you travel through the donut, the X-rays pick up both 2D but also 3D images of the body and the tissues. And these images then get transferred to a computer and you should have what you need. Although CT scans can detect some muscle issues, they're much more commonly used to have a look at bone and joint problems. So conditions such as osteoporosis, fractures, bone infections, and even bone tumours. But they're very widely used in many other conditions relating to other organs in the body. Now you're going to get 2 for 1 in our 5th and final investigation. We're going to talk about EMGs, which are electromyographs, and we're going to talk about nerve conduction studies or nerve conduction velocity tests. Now EMGs detect the electrical activity in your muscles, and nerve conduction studies detect the electrical activity in your nerves. Now these 2 studies can be completed separately, but they're often completed together. Now a nerve conduction study works by placing 2 electrodes along the pathway of a nerve. One of the electrodes stimulates the nerve and the other electrode picks up the results. And what they're testing here is the speed at which the electrical impulse travels along the nerve. This is then compared with normative values to tell if there is a problem or not. EMG works by placing tiny electrode needles directly into the suspected affected muscles, and they will detect the amount of electrical activity in the muscle both at rest and during a muscle contraction. Again, these results will be compared with normative values to see if there is an issue or not. Both of these investigations are used to detect issues with nerves. So conditions such as carpal tunnel syndrome, problems with the sciatic nerve, disc herniations, nerve palsies, both acute and chronic polyneuropathies, traumatic nerve injuries, and diabetic neuropathies are all assessed with these diagnostics. So to recap, the 5 main scans, investigations or diagnostics that are used for musculoskeletal conditions are X-rays, ultrasounds, MRIs, CT scans and or EMGs and nerve conduction studies. Make sure you stay tuned for part 2, which is the juicy, important stuff about when it is and isn't appropriate to have a scan, and that will be coming to you next week. As always guys, thank you very much for watching. I hope you found today's content useful. If you have, then a thumbs up and a like is very much appreciated. And if you haven't already, subscribe to the channel so you don't miss any more of Genuine Physio's videos. We're keen to interact with you, so come and find us on social media, Instagram, Facebook and Twitter. And if you want to leave any feedback, then drop a comment below. You should also find some links to other videos that we've done that you might find useful in the description below. But obviously you can always go and take a look at the YouTube channel. Until next time, we'll see you again very soon.